Hello, my name is Sarah Polk. I'm a primary care pediatrician and a clinician scientist. I focus on optimizing pediatric primary care for Latina children and immigrant families, with a particular interest in mental health and child healthy weight. I'm presenting today on behalf of a multidisciplinary team that includes psychologists, psychiatrists, and community health workers. The title of my presentation is Overcoming Challenges to Implementing an Intervention for Parents of Suicidal Youth Delivered in Primary Care by a Community Health Worker. I presented this work at the Pediatric Academic Society meeting in 2025. Pediatric primary care is an important venue in which to identify and reduce risk of suicide. Suicide is the third leading cause of death among 15 to 24-year-olds and the second leading cause of death among 10 to 14-year-olds. My objective today is to discuss the implementation of the Paloma program, in which pediatricians who recognize risk of suicide in their patients refer the patient's parent to support delivered by telephone by community health workers. We used implementation science methods and organized our project according to the Consolidated Framework for Implementation Research. Our project leadership team sought iterative feedback from pediatric practices and clinicians that we asked to host the Paloma intervention and refer patients. We gave initial 15-minute presentations regarding the overall intervention. We conducted brief check-ins at standing provider meetings, and providers were invited to provide direct feedback via email or the electronic medical record. In regards to challenges and our responses or adaptations of the program, the most important was that we decided that this should be a pragmatic trial. So recognizing constraints faced by pediatric providers, when a pediatrician recognized suicidal ideation in a patient, they were able to refer the parent without obtaining consent for research. We offered research participation later, but it was not required for the parent to receive the intervention. This greatly reduced the burden on the pediatrician and was a very popular aspect of our plan. Providers did report that it was a challenge to remember the program given the relative infrequency of suicidal ideation. In response to that, we laminated business cards that we affixed to provider desktops. We made parent manuals in bright colors available in workrooms as a visual reminder. We gave brief pearls about managing suicidal ideation at routine provider meetings. And we are creating a library of parent and youth psychoeducation materials for use in primary care and delivering them to participating practices at regular intervals. Primary care providers are increasingly responsible for managing mental health problems at the intersection of increased mental health need and insufficient specialty care resources. While the Paloma intervention was greatly received by participating practices, we've had to overcome a number of implementation barriers. Our lessons learned may be useful to practices taking a systematic approach to suicide risk screening and brief intervention. I would like to thank my colleagues, and most especially the Paloma Parent Mental Health Advisory Board, which guided all aspects of this project. Thank you very much.